Hi everyone. Today we are going to talk about what to do if you or someone else gets bitten by a dog. Dog bites can happen unexpectedly, which can cause the deadly neurological infection rabies. Rabies will lead to death if untreated. Knowing the basics of first aid and consulting a doctor immediately can help prevent infection and other complications. Step 1. Stay calm and ensure safety. First, move away from the dog safely and take a deep breath. Staying calm helps you act quickly and clearly. Call for help if needed. Make sure the surroundings are safe so that no one else gets hurt. Step 2. Wash the wound. Immediately. Wash the wound under running water for at least 10 to 15 minutes, even if the wound is bleeding or not. Cleaning the wound with soap and water helps remove bacteria and lowers the risk of infection. Allow the water to flow through the wound. Do not scrub the wound. Step 3. Stop the bleeding. If the wound is bleeding, apply gentle and steady pressure using a clean cloth or sterile gauze. If possible, elevate the injured area to help control the bleeding. Do not tightly seal a deep wound without medical advice. Step 4. Apply antiseptic. After cleaning the wound, apply an antiseptic solution such as povidone iodine or chlorhexidine. Avoid using hydrogen peroxide solution on the wound. Step 5. Cover the wound. Apply a sterile bandage to protect the wound. Ensure that the wound is not tightly sealed. Consult a surgeon or physician for further evaluation and treatment. Post-exposure, prophylaxis, PEP, categories. Dog bite exposures are classified into 3 categories based on severity and risk. Category 1 involves minimal contact and does not require any PEP. Category 2 includes minor injuries and requires immediate rabies vaccination. Category 3 is high risk and requires both vaccination and rabies immunoglobulin. After a dog bite, timely rabies vaccination is essential to prevent infection. The vaccine should be started as early as possible and completed as per the recommended schedule advised by a healthcare professional. Important. It is important to report the dog bite. Every dog bite should be taken seriously. Do not ignore even small puncture wounds or minor scratches. Do not delay consulting a doctor. Observe the dog for 10 days. If it remains healthy, the risk is minimal. If possible, collect the dog owner's contact details. Also try to confirm the dog's rabies vaccination status. Complete the course of anti-rabies vaccination as advised by the doctor. Rabies can also be transmitted by other animals such as cats and monkeys. Follow the same steps in case of any contact with these animals. Remember, prompt first aid and timely medical care can prevent rabies and serious infection. Stay safe and stay informed. Thank you.